Okay, I have 12 on my clock, so we will go ahead and get started. Hello, everyone. Thank you for joining the Office for Human Research Protection's webinar series on the Common Rule. Today's webinar, Promoting Research Representation and Engagement Opportunities under the Common Rule, will be presented to you by Public Health Program Specialist Mariana Azar. This webinar will be recorded and will run for a total of 60 minutes, including a live Q&A session. If you have questions, please submit them through the chat. Certificates of attendance will be issued to all who have registered. The slides will be available on OHRP's website under the past events section, and the recording will be available in around a month. We will go ahead and get started.
Thank you, Zena. Bear with me while I share my screen. Okay, I trust everyone can see that. Please let me know if you cannot. Okay, so to start us off with our standard disclaimer before we get started, any opinions I may express during this presentation are my own and do not necessarily reflect the policy of the United States Department of Health and Human Services or the Office for Human Research Protections. Any references to the regulatory provisions in the Common Rule in this presentation have been simplified to facilitate understanding. Please always refer to the actual text of the Common Rule available on the OHRP website for a complete and accurate description of the regulatory requirements. The hyperlink that is provided on this slide will take you to that page. In this presentation, I'm going to aim to briefly explain the historical events that led to the development and publication of the Belmont Report in 1979, detail the way the principle of justice was articulated in the Belmont Report, offer an overview of historical events that have affected our interpretation of the Belmont principle of justice, and then explore relevant provisions in the Common Rule that we can lean on to promote representation and engagement in research. And so to start with the historical origins. Now, in the 19th and 20th centuries, we can point to several research experiments in which the poor, marginalized, and vulnerable were used by researchers for experimentation that posed a significant burden on subjects with little or no benefit. Among the most notorious are, of course, the U.S. Public Health Service syphilis study, the Nazi concentration camp experiments on prisoners, the hepatitis studies on mentally disabled children at the Willowbrook State School, and many others. Now, the through line in these cases is that both individuals and populations, namely those in positions that made them vulnerable to exploitation, were singled out to bear the burdens of research for the benefit of others or for the benefit of advancing scientific knowledge. And as the public began to learn of these exploitations, there was understandable and quite notable outrage, as well as a call for political action. Now, this eventually prompted the creation of the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research, or as it is more commonly referred to, the Commission, and then also the subsequent publication of the Belmont Report in 1976. The concept of justice, at least as it applies to research involving humans that many of us are familiar with today, was introduced in the Belmont Report. And in the report, justice referred to a fairness in distribution or a balance in the risks of possible harms incurred in research against the benefits expected to result from it. So to flesh this out a bit further, the report asserted that there should be fairness in the research procedures, the research outcomes, and in the selection of research subjects at both the individual as well as the societal levels. It also put forth the notion that research that holds out the prospect of a special benefit should not be reserved for only favored individuals, nor should risky research enroll only undesirable persons. Social, racial, gender, or other cultural biases should not, the report stated, be allowed to unbalance the fair distribution of burdens and the potential benefits of research. To put it more crudely, the report called for a focus on the selection of research subjects as a way to advance distributive justice in research. And it also put forward the notion that historical practices that involved selection of disadvantaged populations for research on the basis of their comparative availability and low social standing, especially when these populations ran the risk of harm and then more advantaged populations reap the eventual benefits of the research, required that certain groups of vulnerable populations, namely pregnant women, children, and prisoners, receive additional protections and that researchers offer additional justification when seeking to include them in their research. So the Belmont Report serves as the ethical backbone of US federal regulations governing human subjects research. And since Belmont frames justice in terms of protection, both our ethical as well as regulatory framework carry certain assumptions about research risks and required protections for research participants from those risks. So if we think of research as potentially being exploitive of certain individuals or groups, we are pushed to be cognizant of the need to select subjects for research participation who are not already bearing other societal burdens. And when we're considering vulnerable populations, such as children, prisoners, pregnant women, individuals with various disabilities, or the economically or educationally disadvantaged, we are asked to consider the danger of their involvement in research solely for administrative convenience or because they are easy to manipulate because of their situation. And so with that framing, we are required to impose additional protections for these groups or to seek additional justification for their involvement in the research. So where does this framing of justice as protection lead us, and what problems does it create? Well, one of the most notable challenges to the way that we think about and apply the principle of justice to equitable selection of subjects came in the 1980s and 90s. The early research on the treatment of AIDS in people infected with HIV was the catalyst for this shift. Now, at the time, AIDS was having a very significant impact on the health of the gay community in the United States. And yet, according to the traditional interpretation of the principle of justice, researchers should have been cautious about actively recruiting prospective research participants from the gay community for clinical trials, because after all, gay people were a vulnerable group frequently discriminated against in the United States. And so from this viewpoint, the gay population would have been unfairly exploited if they were to be predominantly recruited into the early HIV/AIDS clinical trials, because after all, they would bear a large portion of the research-related risks, while the eventual benefits of the research findings would lead to effective treatment for people with AIDS who were more socially advantaged and not necessarily marginalized or discriminated against. For example, those who had acquired HIV through blood transfusions or other avenues that society did not scandalize. But the gay community actively advocated for a different posture towards the research. They pressed to be included in a significant proportion of the treatment studies and actually promoted the view that the research findings would have a greater likelihood of benefiting their community if they were to be included in these initial studies. Exclusion, they argued, posed the risk that the findings of the research may not be applicable to the gay population. And so the principle of justice was turned on its head. Instead of protecting an otherwise vulnerable population from exploitation, the dominant concern became one of avoiding exclusion from research participation and mitigating the possibility that a population in need of treatment would not stand to benefit from the findings of these treatment studies. Now, in the middle of this slide, you'll see a keynote address that Dr. Anthony Fauci gave in 2014 on the difficult choices faced in the early years of the HIV/AIDS epidemic, including the connection between that historical battle and more contemporary challenges, such as equitable selection of subjects for the Ebola vaccine studies and related. This video, among many other lectures by highly esteemed individuals with thought-provoking insights on human research protections, is available on the OHRP Division of Education and Development Luminaries Lecture Series page. So if this topic is of interest to you, I encourage you to check out that recording. Now, the concern of being excluded from research participation soon spread to other groups, including other groups of vulnerable populations, such as pregnant women, children, and individuals of various ethnic and racial backgrounds. Representatives of these groups began to advocate for the inclusion of their populations in relevant research studies in the view that leaving them out could mean failure to get their fair share of the benefits of research. This perspective also became embodied in such policies as the NIH requirement regarding the inclusion of women, minorities, and children in research studies where appropriate. Public attention also shifted to prominent issues that underscored investigator failure to consider inclusion and representation in study design, which resulted in study findings that were not sufficiently generalizable because the participant groups were not reflective of the general population. One example of this is the drug Plavix, which is prescribed to prevent strokes and heart attacks. Now, as a blood thinner, Plavix needs to be activated by the body's own enzymes, which it was determined after the drug came to market and became quite commonly prescribed to the broader population can vary genetically. Subsequent studies have shown that about 14% of Asian patients are unable to metabolize the drug properly, compared with 4% of Black and just 2% of white patients. Now, in 2010, the US Food and Drug Administration issued a new warning label for Plavix to reflect this information. More recently, we've also seen the impact that exclusion of certain groups from clinical trials, such as the exclusion of pregnant women from the first wave of the COVID-19 vaccine research studies, has on public health, as well as efforts to address the public health emergency, such as the COVID-19 pandemic. Another major shift in the way that we think about and apply the principle of justice and research-related harms stems from the growing attention to the concept of quote-unquote group harm and the question of whether research studies should not lead to harms to identified groups because of participation of their members. Now, a series of studies using biological samples from members of the Arizona Havasupai tribe motivated some of these discussions and considerations. The Havasupai had agreed to provide samples to enable a research study addressing the rates of diabetes among their tribe members. But later, they learned that additional secondary studies were proposed to examine questions related to mental disease prevalence, as well as a study of geographic ancestry. Now, the Havasupai objected to these secondary studies because the study on mental disease was potentially stigmatizing and the study on geographic ancestry potentially in conflict with their traditionally held beliefs regarding their geographic lineage. Now, cases like this prompted the argument that the Belmont Report focus on the protection of individuals rather than groups was too limiting, and the principle of justice specifically ought be modified to include consideration of group harms. And so in this respect, the principle of justice would be expanded to encompass social justice insofar as our focus would be on whether society shows the proper respect for the rights and interests of particular groups, especially those groups who have traditionally been the victims of some form of discrimination. Now, if you're interested in this particular topic, I encourage you to check out a recording of the 2021 OHRP Exploratory Workshop on third-party research risks, as well as the 2022 SACRARP recommendations on the protection of non-subjects from research harm. Now, some groups have also used the principle of justice to motivate researchers to address inequities in society through research aimed at finding ways to ameliorate those inequities. Now, this can be seen in the increasing role that research participants as well as communities play in the selection and the design of research studies, as well as the growing popularity of community-based participatory action research, citizen science, and initiatives such as the Patient-Centered Outcomes Research Institute. Now, with these efforts, justice is reconstrued to reflect the democratic principle of the public having more of a direct say in what research society is willing to support, rather than leaving those questions to the peer-reviewed decisions of expert scientists or those in positions of power within academic and research institutions. Now, this often translates into a focus on justice-oriented research or research as a partnership between participants and researchers. And so from the 1980s to today, we see a shift in the way that we think about and apply the principle of justice to human subjects research. We see a recognition of the potential benefits offered by research and a corresponding demand from the populace to be included in research to potentially derive said benefits from research participation. We also see a shift in focus. So rather than protecting the vulnerable by excluding them from the research, we now see equitable selection to mean inclusion. So in essence, we have shifted our focus to the importance of fair distribution of research benefits, rather than simply talking about ways to avoid uneven distribution of research burdens. We also see more scrutiny applied to exclusion that is based on the principle of justice as protection. There is now a better understanding that prior guidance around the selection of research participants had led to unnecessarily excluding some individuals and groups. And so what we are left with is a principle of justice that calls on us to promote representation and engagement in research, and to also think about and define justice in broader and more nuanced ways than previously formulated. So now let's take a look at the common rule and see if there are regulatory provisions that we can lean on to help further the idea of promoting representation and engagement in research. Okay, so if justice means access, the old idea that participating in research is a burden and that participants may sometimes be exploited requires a reorientation to a more proactive and positive take on research participation. But what does this actually mean? Well, this means that we must make an effort to raise the opportunities of the vulnerable, the marginalized, or the underserved to access research that matters to them, and to ensure that research studies are safe and inclusive and their results are generalizable, so that groups inclusive of the vulnerable, the marginalized, or the underserved could also reap the benefits of the research findings. Now, of course, we cannot overlook or simply erase the history of exploitive and unethical research or the subsequent distrust that still persists. So part of the effort to promote justice as access to research might also involve reaching out to individuals of traditionally underserved or exploited groups and their communities with the goal of building trusting relationships. So what about IRBs and investigators? What can they do and what role do they play here? Well, we can start by looking at the IRB review criterion of equitable selection of subjects. Now, until recently, IRB reviewers and investigators may not have paid too much attention to this criterion. Many would simply assume that the subject populations that investigators have included in their research protocol were appropriate. And when investigators mentioned any exclusions, unless they were quite obviously unreasonable or egregious, few reviewers would question the justification for excluding certain groups or people. However, this review criterion specifically requires IRBs to consider the purpose and the setting of the research when deciding if subject selection is equitable. The idea here is that the principle of justice plays itself out at the time of recruitment, and through an equitable selection of subjects, the research is assumed to have a fair distribution of the burdens and benefits of research. So what this means is that who you approach for recruitment, as well as where and how you approach them, may be a significant factor for IRBs to consider. Reviewers and investigators should also clearly understand what the burdens of research participation are and on whom these burdens would fall. Likewise, they should understand what the anticipated benefits may be and for whom. Now, note that burdens are not just the risks of the research to individual participants. There are other burdens that may arise as a result of the setting and the situation of a prospective research participant. And this also deserves appropriate consideration. Now, what do I mean by that? Well, burdens could include the time taken away from work, expenses to pay for childcare to attend a study visit, as well as other opportunity costs and so on. And benefits are not just the potential benefits that individual participants may derive from, for example, their participation in a therapeutic clinical trial. More broadly, benefits may include the opportunities that participants and their communities and groups that they identify with might reap from the research. Now, what do I mean by that? So, this can include, as we commonly talk about it, the generalizability of the research findings, the new treatments and interventions that may result, but there could also be more immediate benefits, such as the resources and the infrastructure that the research might bring to the community or to the group. So, for example, opening a health clinic, providing health screenings, allowing access to medical and other personnel as a result of research participation. Or in the case of behavioral research, let's say gifting tablets to a school that are initially used to conduct the research. So, with that in mind, how do we promote an equitable selection of subjects? Well, we can start by asking very specific questions when the research is designed, reviewed, and then actually executed. We can start by asking who investigators are proposing to include in the research. So, what are the specific reasons for selecting and including these specific individuals? Is this selected subject population appropriate for answering the particular research questions that the investigators aim to address? We can also ask if the proposed inclusion is simply a matter of convenience for the researchers. In other words, that investigators happen to have access to this population, or the population happens to be around, is easy to reach, and unlikely to say no. Now, it goes without saying that investigators should avoid exploitation or taking advantage of people or groups, but shining a light on the use of specific groups or populations on the basis of convenience or availability is important. So when we frame things in terms of burdens, we can also say that investigators and researchers should not burden those who have little or no chance of benefiting from the research by inviting them to participate in it. Now, to put a more positive framing on this, because that is our aim here, we can also ask if the inclusion criteria is a result of thoughtful consideration, such as this is the population that has a high load of the condition that I am aiming to study, and so on. And if not the immediate subjects, then at least their communities might stand to benefit from this research in the long run. When you think about benefits, if no direct benefits are to be considered, then focus at least on what the indirect benefits might be and consider these when considering your selection of subjects. We should also actively ask why investigators are excluding certain people. So, what are the justifications? Are the reasons for exclusion specific and compelling, or are they just general and kind of vague? Is the exclusion just a matter of expedience or convenience for the researchers? Now, remember that unnecessarily precluding certain individuals, such as, for example, non-English speakers or those with accessibility needs or those with caregiver responsibilities that may preclude them from daytime study visits, from participating, limits the generalizability and the applicability of the study. In the long run, this could further disenfranchise certain communities and contribute to the erosion of trust, as well as perpetuate disengagement in research. Now, on this slide, you'll see a screenshot of an interactive scenario that OHRP has developed on considerations for reviewing human subjects research, and this one specifically on the criteria of equitable selection of subjects. Now, I very much recommend completing this training to gain insight into how IRBs can deliberate and what points they can consider when aiming to ensure an equitable selection of subjects for research participation. Now, to go a little bit further, The criterion for equitable selection of subjects has a chance to be realized, as we said earlier, at the time of recruitment. So it is advisable that reviewers proactively ask investigators what they are doing to facilitate a broad participant pool. For example, IRBs can ask, how much do investigators understand about their target communities? Is there a strategy for outreach and recruitment? Is there a genuine and appropriate effort to involve the marginalized and other minority groups who may stand to benefit from the research? Are there needs, concerns, or considerations or other things that are particular to these groups or communities? And are there particular barriers that might significantly affect the participation of those in the targeted communities? And if so, what are the investigators proposing to do to address these? What about vulnerable individuals who may be involved in the proposed research? Have investigators included any additional safeguards to protect their rights and welfare? Have they allowed for the necessary inclusion considerations to allow for their participation? Remember that it's the same extrinsic, circumstantial, situational factors that render individuals vulnerable, such as unjust socioeconomic structures, a lack of power, a lack of status. These are often the same factors that cause vulnerable individuals to have fewer opportunities and less access to research-related benefits. So in considering how to better protect the rights and welfare of vulnerable individuals, IRBs and investigators could also consider how to revert some of these factors to facilitate access to benefits and increase opportunities open to those vulnerable or marginalized. Now, IRBs can go even further by inquiring what investigators are doing to maximize the value for the participants. They can ask, for example, what could investigators bring to the participant community? What level of community engagement have they already sought or plan to undertake? Now, apart from reaching participants where they are to reduce the burdens for them, we can also ask what efforts are investigators making to maximize the value for participants. For example, are there plans in place to keep participants informed of the progress of the study, to update them on how their participation may be making a difference and how the communities that they identify with may be able to take to benefit from the research, and so on. Now, to switch gears for a moment, we can also look at the regulatory requirement for informed consent, which is obviously rooted in the Belmont Report principle of respect for persons rather than justice. Now, the Belmont principles are, of course, interrelated. So is there a way to leverage the regulatory requirement for informed consent to advance justice and promote representation and engagement in research? Well, the general requirements in the 2018 Common Rule stipulate that, among other things, informed consent provide information that a reasonable person would want to have to make an informed decision about whether or not to participate in research. The requirements also state that informed consent documents should begin with key information or information that is most likely to assist someone understand the reasons for why they might or might not want to participate in research. Information is also required to be presented in sufficient detail and organized and presented in a way that actually facilitates understanding. So how can any of this be used to promote engagement and representation in research? Well, note that the regulatory requirements reflect the purpose of informed consent, which is about making sure that prospective research participants have a fair chance of getting and understanding the information they need to make an informed decision about their research participation. So if we think about the purpose of informed consent, how can we apply the regulatory requirements with the aim of advancing justice? Well, we can adopt a participant-centered perspective to informed consent, and we can pay very close attention to who needs information, what information they may need, and how we give them this information in a way that would allow them to understand it and how it relates to them in order to make a meaningful decision about their research participation. What this gets at is the need to provide information about research from the perspective of the person who is going to be receiving it and trying to make a decision for themselves about participation in research. This is what we call the participant's context or perspective. So in other words, when you're describing highly complex medical procedures to potential research participants, you really need to think about how they're receiving and making sense of this information. So what this really means is we need to learn about our participants and the way that they may interpret or receive information we give them. Now, one way that we can learn about potential research participants is by relying on things like community partnerships and consultations. We can hear from community ambassadors. We can do general community outreach to get to know our prospective research participants. When we write consent documents with input from those who reflect our intended participant pool, we have one way of ensuring that the content addresses the informational needs of participants, and moreover, that the information is being presented in a way that participants can truly understand and make sense of. Now, all of this works to empower individuals and promote their engagement and representation in research. And so, respect for persons could actually be a key component for realizing justice. One might even argue that respect for persons, or making sure that individuals feel that they have the information they need to make their own decisions, their own informed decisions about whether to participate in research, is where this all starts. This also means that investigators, of course, need to learn how to communicate effectively and with intention to promote trust. The intention here is, of course, to empower prospective participants to help them become partners in research. In this sense, an effective informed consent demonstrates a respect for persons and enhances public trust and engagement in research. Now, another thing to consider is that the Common Rule also stipulates requirements for IRB membership that embrace the goal of diversity and inclusivity. Now, institutions should recognize the important value that appropriate representation brings to the richness of the ethics review process. The process, the conduct of research involves people. And at the end of the day, the pursuit of science is, of course, for the benefit of people or for the pursuit of the common good. IRBs, therefore, benefit from having a membership that appropriately and adequately represents the people who would be impacted by research. So institutions can pay more attention to both the size as well as the makeup of their IRB membership, and they can put extra effort into finding a bigger group of unaffiliated non-scientists or community members. Community engagement efforts have the advantage of being able to bring in cultural ambassadors whose work could help engage the community and contribute to building a pool of community members for the IRB. Even for the non-scientist member, for the scientist member, you can think about diversity whenever you have access to people with comparable scientific backgrounds. Now, if you do want more information on community engagement and consultations, I encourage you to check out OHRP's Luminaries series, which includes several videos on this topic, including a video from Yale that describes how they've been able to approach this effort. On this slide, you'll also see a training checklist that we've developed for someone working with an IRB. It can be a challenge to train members from the community, especially from the perspective of providing education to acclimate them to the basics of research protection and research participation. So this checklist of resources can be used to educate members from the community who may be providing guidance to your research teams or serving on or consulting with your IRB. And of course, like all of our resources, this tool is free and written in plain language, and of course includes links to videos and other interactive components that are really designed to facilitate understanding. So to summarize all of this, research is of course a connected framework of partnerships and commitments. And to ensure public trust in research, to ensure that research continues to thrive and that each of us in our different roles needs to do our part and chip in to this process. Now, I want to highlight some additional educational resources developed by OHRP that you can use to advance justice at your institution. I specifically want to highlight our About Research Participation page. Now, in addition to brochures and posters explaining research and research participation, we have developed a list of questions to ask, a series of videos that explain research and research participation, and even a series in which we interview past research participants about their experiences. Now, all of the resources on our ARP page are, of course, free. They're also available in both English and Spanish, and they're there for you to use to educate the public about research and research participation. There are also a number of upcoming OHRP educational events that I want to bring your attention to. If you've been enjoying our free webinar series, please mark your calendars now for 3 additional webinars that we will be hosting this summer, and you have the topics on the slide in front of you. Now, you will need to register to attend these events, so please be on the lookout for that information in both our listserv announcements as well as on our website. I'm also very excited to announce our upcoming 6th annual exploratory workshop. Now, this year's event will explore the ethical and practical considerations for psychedelics research involving human participants. This is, of course, a super timely and hot topic, and we hope that many of you will be able to join us for this event via free live stream on September 14th. The full agenda for this event, including speaker information and session descriptions, is available on our website, and you have the link for that on this slide. Be sure to also check out the agenda for our upcoming Research Community Forum with the University of Michigan on September 26th and 27th. More information about this event, including the complete agenda, are available on the link provided on the slide. I also want to point you to the OHRP website, including our Luminaries lecture series, which I've mentioned quite a number of times throughout this presentation. You can also review the SACCARP recommendations on considerations on the principle of justice. And last but not least, I also want to highlight our email address. Now, OHRP is a small office, but we are also always happy to help and to engage with the research community and answer their questions about the common rule regulatory requirements. So please email us at ohrp@hhs.gov, and we will do our best to answer your questions. And with that, I thank you, and I look forward to your questions.
Good afternoon, everyone, and thank you, Mariana, for that very informative and enlightening presentation. I know I enjoyed it, and I hope the audience did as well. So we do have a couple questions, and as Mariana said, if you, the audience, have any questions, please put them in the chat box now, and we will hopefully be able to answer them. We do have a fair amount of time for questions, as we hope to end by 1. So Mariana, let's get right to it. The first question we have is, we're struggling with, quote, justice means access in the area of non-English speaking participants, particularly here in this example, Spanish speaking participants. The protections historically included specifying inclusion of non-English speaking and requiring certified translations of the materials that would go to the individuals.
Yep.
But now they're seeing, I guess, a shift, if you will, studies that are not excluding and also not targeting non-English speakers, but may recruit them because they're otherwise eligible. And to just expand upon this a little bit more, it seems like the anti-protection and a barrier to access by requiring the certified translations or not allowing the Spanish-speaking study staff to speak the information in Spanish, if that's more comfortable for the participants, even if the materials are at this time only available in English. So the question is, do you have suggestions for a middle ground of protection without the, quote, special or vulnerable protections, like a general respect for persons? And I realize that was a couple parts to that with the explanation at the beginning. So please let me know if you need me to repeat anything.
Yeah, I mean, if I understood correctly, this is actually a question that also came up at a recent event that we held in Knoxville, Tennessee. So it was a question of, how do we make it possible to include non-English speaking subjects if they are incidentally included as opposed to targeted for the research? And what do we do if we have limited resources at our institution and cannot afford the highly expensive translations or hiring of research staff that are fluent in Spanish or in other languages that participants may speak? One of the things that we suggested at that event, and I remember there was also some input from the audience, was, there are groups within the community who might be happy to help with the research efforts, who may be willing to volunteer their time to informally offer translation services. And now that a lot of things are also conducted remotely, or that there are avenues to connect with people by phone as you may be interfacing with them in person, you could always rely on connecting with these individuals through those channels to offer that kind of live translation, at the point of recruitment or at the point of consent. So I think that there are always ways around the hurdles. I also think that there are groups that really intimately understand the value of research and research participation and are willing to volunteer their time, their expertise, their resources in order to allow for others that they consider to be members of their groups to participate in research studies. Michael, did you want to add anything to that? I know that we had quite a long discussion about this at that event.
I think that's pretty thorough, and something that Mariana did mention in her presentation is pairing with these community organizations, community leaders. And if you're able to be with them from the beginning, then you can anticipate kind of down the road in your trial what sort of needs you might have as far as translation resources and things like that. But I thought that was a great answer, Mariana.
And Michael, as I'm keeping an eye on the chat, I see that someone is asking if these would necessarily become members of the research team and require institutional training. So if you don't mind, maybe I can just address
Please.
this very quickly. So the question of training, I just want to clarify this point because we often get this question in the OHRP inbox. The common rule does not require training for researchers or investigators. These are typically institutional requirements. Now, of course, there is a really clear explanation for why human subjects training would be required for somebody who is either directly a member of a research team or interacting with human participants. But there is no regulatory requirement for training. Institutional policy. The common rule also does not define who is and who is not a researcher. It does define who may be engaged in the research study. I think translations individuals as members of the research team or as engaged in the research.
Great points, Mariana. And just to note, the presentation, both the slides and a link to the video will be available hopefully next month on our website on the upcoming /past events page. So stay tuned for those. Let's see. Going to the next question. I'm currently trying to write up policies and procedures to recruit ad hoc consultants when diversity of the IRB is not sufficient. They say the lack of knowledge about experience with certain populations. Do you have any guidance that you can lend to this kind of situation?
I don't believe so. OHRP does not have formal guidance on this point, but as I'm sure you are aware, the regulations do allow for the use of subject expertise for IRB deliberation. And I think it's something that you should indeed consider on the institutional level and have institutional policies for. I can tell you that there are many institutions with such policies on the books. It's always helpful to take a look at what your peers have done and mirror their expertise. As I mentioned, we have a video from Yale University's HRPP and the efforts that they have made with community consultations. That may be a good starting point to see what they've done on this topic.
Great, thank you. I'm just looking through now. We seem to have more on limited English proficiency questions, but I'm trying to find something on a topic that you haven't quite covered yet. Let's see. So we have one right here. So you mentioned engaging with communities to maximize benefits. What about also engaging with them to minimize potential harms?
Absolutely. I mean, the whole point of engagement is to learn from them, right? And to learn from them about both what the research could do for them, as well as the obstacles that the research could pose, or the potential harms that the research can pose to those that are identify as members of a particular group. I mean, the entire consideration of the Havasupai tribe experience, I think, speaks to that, right? I think that if there had been sufficient consultation with this group and an adequate understanding of what their concerns may be, those secondary studies may not have been proposed, or maybe perhaps would have been proposed, but in substantively different ways, because there would have been that recognition that, for example, geographic lineage is a significant point of concern or consideration for this particular group. So yes, the whole point of engagement and consultation is to really learn from the community and then design the research or adjust the research accordingly to reflect what the community has expressed as being of importance to them.
And I think this is also a good time to again mention that we've come up with materials for the lay public, people who are not otherwise experienced to research, so that you, the researchers, or you, the HRPP, can use these to work with these populations to help gain exposure to what is research, just the basic questions. And also, as Mariana said in her presentation, we have created a checklist that can be used if you're trying to recruit a lay community member, but as well as you can give these to the community leaders so they themselves can then educate and talk to the people within the community whom they serve. So let's go back to the questions.
And sorry, as you're scanning, I'm also seeing the question about city training. So there's a question that reads, we're using city training completion for co-researchers or people that are part of the research team. Did you say this training should not be a requirement? No, by no means. I did not say that. I'm saying that the common rule regulatory requirements do not stipulate training requirements for researchers, but that's not to say that they say that it's not allowed. It is up to the institution to require training for researchers as they see fit.
So I'm gonna paraphrase a question here. It is dealing with AI, which is of course a hot topic, but it does get me thinking about technology. And perhaps would you like to say anything about working with certain populations that might not have the available technology, whether it being internet, cell phones, things of this nature, how a researcher might be able to navigate something like that?
Yeah, I mean, this is all a question of accessibility, right? So
Hmm.
indeed, there are populations for whom, let's say, broadband access is not the is not as relatively available as it would be to somebody living in a major city. There may also be somebody living in a major city who may not have a cell phone for a variety of reasons, including their financial standing. All of these things matter. And I think, I can't tell you how many research studies in my prior life and prior career I've